Achoo! Today we are discussing allergic rhinitis triggers. Allergic rhinitis, also known as hay fever, is a common condition affecting about 20% of people of all ages. Its most common symptoms include nasal itching, watery nasal discharge, sneezing, itchy red eyes, sore throat, and a hoarse voice.
It's Doctora Victoria and George.
Allergic rhinitis is caused by an allergic reaction to small airborne particles called allergens. These particles can cause reactions in the lungs, like asthma, and eyes, allergic conjunctivitis, and in some people. The first step in treating allergic rhinitis is to avoid or minimize exposure to the allergens that cause the condition. Although this can be helpful in reducing symptoms, there may be a trade-off between avoidance and quality of life. Where avoidance is inadequate to control symptoms, we have options to treat allergies. There are four major categories of allergens that trigger allergic rhinitis. These include pollens, insects such as house dust mites and cockroaches, usually cockroach poo, animal allergens such as skin, fur, feathers, and saliva, and molds. In some cases, it's easy to identify a person's triggers based on when symptoms develop, like during a particular season or after exposure to a dog or cat. However, in people with year-round symptoms, it may be more difficult to pinpoint the allergen. Once a person's triggers have been identified, the next step is to reduce exposure to those specific allergens. Triggers may be presented at work or home, although for most people, the home environment is the primary source. It's especially important to reduce exposure to triggers in the bedroom because most people spend a significant number of hours there. However, to be effective, changes must be made throughout the entire home. Dust mites are a microscopic type of insect that live in bedding, sofas, carpets, or any woven material. Dust mites do not bite and do not cause harm to humans, other than by triggering allergens. Exposure to dust mites can be reduced by encasing pillows, mattresses, box springs, comforters, and furniture in mite-impermeable barriers. Tightly woven fabrics with a pore size of 6 microns or less are very effective at controlling the passage of mite as well as cat allergens. Mites can be eliminated by washing sheets and blankets weekly in warm water with detergent or by drying them in an electric dryer on the hot setting. Exposure can be further reduced by vacuuming with a vacuum cleaner equipped with a high-efficiency particulate air filter. That's one of those HEPA filters. Dusting regularly, and not sleeping on upholstered furniture. However, studies have yet to show that physical or chemical cleaning methods reduce mite levels to a degree that improves symptoms. Indoor humidity levels should be kept below 50%. Humidifiers make the problem worse and are not recommended. When possible, the amount of clutter, carpet, upholstered furniture, and drapes should be minimized. And horizontal blinds should be eliminated in the rooms where the person spends the most time, like the bedroom or maybe studying, wherever you do that, or watching TV. But the more time you spend with me, you may notice you're not watching as much TV as you are, since you're going to be out and about being active. If symptoms are severe or persistent despite avoidance of the allergen, you should go ahead and have a chat with your doctor. There are some medications that we can prescribe, and many over-the-counter that are available. Think antihistamines like Allegra, Zyrtec, Claritin, or steroid nasal sprays. Flonase, Nasacort, Rhinocort, and the generic grocery store versions, they work just as well, but most people do not use their nasal spray correctly. You want to point the tip up towards your ear, and you can either have your chin up in cookie sniffing position, peanut butter cookies, or looking down towards your toes. The allergists, they seem split on what they want you to do, looking up or down at your toes, but the most important part is pointing out towards your ears. If you go straight up, the medicine goes down the back of your throat and doesn't do you any good. If you go in towards the septum, that's the middle part of your nose, you are likely to give yourself a nosebleed over time. As well, those steroid nasal sprays, they take at least a week to start working. They are not the kind of medication that you just use when you feel congested. It'll do diddly squat for you if you just use it every now and then. If you are in a high pollen count region, you may be using a steroid nasal spray for most of the year. It's local and in most cases safe to use. Local as in it just stays right up there in the nose. Swapping the oral allergy pill and steroid spray for a similar but different one every 4 to 6 months or so can help keep the medicine working too. We've got some other treatments when those modalities don't work, and if allergies are really bad, the person may be referred to an allergy specialist for further testing and treatment. Allergy specialists can identify each person's triggers so that he or she can focus on reducing exposure to the triggers that are important to him or her, and even get further therapy to decrease symptoms. But they can be time-consuming, like those weekly allergy shots. But thank you for joining us today, our healthcare team. We hope you enjoy some sunshine. Use that nasal spray if you're having symptoms, and we'll see you next time. Bye-bye.